Association, and she is here to tell us about what this year's report really shows. Good morning, Vanessa. Thank you for being here.
Good morning, Wayne.
You know, you guys sent us a lot of really interesting information, but the thing that really jumped off the page to me was 7 million Americans are affected by this disease, and that doesn't count the 12 million who are tasked with caregivers and family members and things like that.
Exactly. And this is the first time in history that that number has actually gone over 7 million. And so definitely something that you know, we need to be aware of and be on top of, and why research is so important.
Well, and I think you don't have to reach far to find someone in your family, friendships that has been affected by this disease. Now, the 2025 report has come out. What are some of the things that stand out to you?
Well, one of them, for North Dakota specifically, unfortunately, Alzheimer's disease has risen to the 4th leading cause of death in North Dakota, up from 5 last year. And then I think the other startling data was really about the number of deaths in the United States related to Alzheimer's. In between the years of 2000 and 2022, those numbers have doubled.
It's amazing, and that was one of the questions I was going to ask you. Is there a reason behind the increase in deaths? Is there something they can point at or put a finger on? I
think there are a lot of questions that
theories,
people are,
yeah,
it's probably a good word, theories that people have. It can be, we have, you know, an aging population in some states. We also have better diagnosis, so people are getting diagnosed more often, and it's definitely that Alzheimer's is in their chart. Maybe previously we didn't know that that was their cause of death, could be part of it. People are living longer, you know, all these things play a role in that, and that actually points to some of the bright spots too, that yes, we have more people dying from Alzheimer's, but we also have more people getting that diagnosis. And you know, we're really working hard to have people get that diagnosis even earlier.
That's what I was going to ask you. Early diagnosis, that seems to be something that people are really interested in finding out, especially if there's a history, right?
Yeah, that was another piece of the report that really came out, like 4 out of 5 people would want to know early if they, you know, before they had symptoms or before those symptoms were affecting their daily life, they would like to have a diagnosis. And that has been inching up, and that's important. And then also that about 9 out of 10 people would be interested in having a simple test that they could do when they go to the doctor to be able to say, you know, yes, you have Alzheimer's in the early stages. And it's also because if they get it diagnosed in the early stages, then they can take advantage of some of the FDA treatments.
Exactly. Okay, now the forgotten people in all of this are the caregivers. How can we reach out to them and offer a helping hand?
You know, that is what we are here for, providing education, providing, you know, an opportunity to help them with that journey of all the decisions that have to be made, and trying to find the resources in their community and being able to connect to those, because sometimes I'm so overwhelmed as a caregiver just doing what I need to do from day to day that I don't have time to look for that help.
You don't have the time to do the research. Okay, now, are there some things that we can do, and we're down to 30 seconds, this needs to be quick. Are there things we can do to decrease the risk?
Yes, we can, you know, things you've heard before, making healthy choices with our food, being physically active, you know, choosing activities that really cause our brain to be activated and engaged and working, and and anything that we do that helps our heart helps our brain. So
absolutely.
Keep those things in mind.
All right, where do we get a hold of you, and what can we find there?
Yes, well, locally you can call us at 701-258-4933, and otherwise you can call our helpline, and I think that is on the screen.
800, there you go. There's the 800 number. Thank you so much.
Yes, well, thank you for having us.
It's a conversation near and dear to my heart, and I appreciate you coming in and taking the time.
I appreciate having the opportunity.